am super excited to talk with Ashlee Wisdom today. Ashlee is the founder and chief executive officer of Health in Her Hue, the premier digital health platform aimed at reducing racial health disparities by leveraging the power of technology, media, and community to improve health outcomes for Black women. Ashlee is a passionate public health innovator and a champion for equitable access to quality care for all. She is currently a board member for Peer Health Exchange, and in 2022, she was named an Aspen Institute Healthy Communities Fellow and was honored by Femtech Focus with the First in Femtech Award. In 2021, she was named a top 50 in digital health by Rock Health for her health equity advocacy and also presented a TEDx talk in 2020. Ashley, I am so happy to have you on the show with us today. How are you doing?
Hi, Tamika. I'm doing well. I can't complain. How are you doing?
Okay, I'm feeling a little, I got a little seasonal cold, but I'm doing okay.
Oh, good. Glad to hear
I
that.
am so thrilled to so not only were you a former Harlem Cycle client, but you are someone who I have always admired in the industry. So tell us just a little bit about kind of just how your wellness journey is going, how it started, how it's evolved, and what you're doing now.
Thank you for having me on the show. And yes, when I lived in Harlem, I was a faithful visitor and client of Harlem Cycle. I miss those spin classes, and I'll have to come back very soon. But my wellness journey really started for me when I was working in I work in healthcare, and I was working for an academic medical center and I worked in a department that was not the kindest or most friendly to women of color, particularly Black women. And I was dealing with a lot of stress and anxiety working in that setting. And that's when it became a high priority for me to start like really prioritizing taking care of myself, being sensitive to the environments that I was subjecting or putting myself in, being more intentional about finding time to prioritize taking care of me before jumping into work and other things. So I would say that that was really the beginning of my wellness journey.
Oh, that's amazing. Because you were coming to Harlem Cycle. Was that during that time as well?
That was during that time. That was actually, yeah, right when I was working in that environment. Yep. So I was being more thoughtful about ways that I can do cardio and find outlets to keep myself healthy from a fitness standpoint, but also mentally as well.
Now, as founder of Healthy in Her Hue, like how are you also prioritizing your health as not only a small business owner, but a founder and someone who's also working again in the wellness space? How are you making time for you now with all that's going on?
Yeah, I would say it's definitely not easy. And so I would not lie to you or the audience and say that it's been an easy journey. It's been, one that ebbs and flows. Like being a founder, it's very demanding on your time. And because of that, it can be taxing on your health. And so I've just been having to be a lot more intentional lately about carving out time to take care of myself. So for me, that means, being the founder of a company that's focused on encouraging women and supporting women with prioritizing seeking out healthcare and being more preventative about their health. I have to walk the walk and not talk the talk. So I definitely make time to prioritize scheduling my well women's visits. So like scheduling my OB-GYN appointments. Um, I do therapy every Monday at noon. So that is something that is on my calendar for my team to see. They know, do not put anything on Ashley's calendar at 12 p.m. on Mondays because she's in therapy. I have a Peloton in my apartment, which is helpful in terms of convenience. But it's also important for me to tap into community, which is why I loves coming to Harlem Cycle. Like being able to connect with other folks, it definitely brings an added layer of accountability. And that community also pours into you beyond just doing the activity. So I would say all those things are ways in which I try to prioritize taking care of myself so that I'm able to show up as my best and most healthy self as I'm doing the work that I'm doing.
Oh, that's amazing. I love that for you. I love that it's on your calendar. Like this is a priority. Like it's as important as any other meeting. I love that. Now let's take just a little pivot to talk about Health in Her Hue. I watched your TED Talk, which was amazing, by the way.
Oh,
Congratulations.
thank you.
Can
Thank
you
you.
just give everyone kind of a background on how you got started and what made you the motivation behind starting?
Yeah, so the motivation behind starting Health and Review was really that experience that I mentioned at the beginning of our conversation. Working for this academic medical center, I was also a grad student at NYU, and I know that we have that in common. Uh, but I was doing my graduate studies at NYU. My background is in public health, so I was pursuing my master's in public health at that time. And I was getting a deeper understanding of the racial health disparities that Black women are facing. Like, we're more likely to deal with pregnancy complications. When we look at diabetes, Black women are disproportionately impacted by different chronic conditions that are avoidable. So I was learning about that in a real academic way, but then and also learning about the social factors in terms of racism and sexism that ultimately takes its toll on our health and makes us more predisposed to some of these conditions. And then in my own a lived experience, I was working within a leading healthcare institution and experiencing racism myself and seeing how our institutions are not designed to be safe for us as women of color, as both employees working in it, and then also as patients who are having to seek care. And that didn't sit well with me. I was like, this healthcare system is not safe for us, and it was built in our bodies, but we're not, reaping the benefits of those sacrifices that we on our ancestors unwillingly had to make. And I decided I wanted to build something that supported women of color and particularly Black women with finding trusted healthcare providers that have our best interests in mind and that see our and understand our lived experiences, and then also providing a safe space for us to find health content that again reflects us. Because sometimes when you Google things or Google different conditions, you don't see people of color, and so that makes patients of color feel isolated or like, am I the only one Black person that's dealing with this? And so I really wanted to make sure that there was a space where women of color could find health content that reflects them, that reflects their lived experience. So that was really the origin story of just being angry, not seeing anything that was built for us, and wanting to do something about that.
Well, listen, it was obviously needed, and I love that because you saw a problem out in the world and you went out and fixed it. Honestly, and that's exactly what you're doing every day. So thank you for that. Thank you, for leading the way for us. Now, you touched on a couple of
Yeah.
things that I wanted to just kind of backtrack on a little bit because it takes us right into the reason why we have wellness redefined. And that is so we can dispel all the myths and untruths and just sometimes practical lies that are just out there in the universe. So tell us,
Mhm.
what has been that one untruth, that myth that has bothered you within the wellness space?
Well, one I would say is, and this is a public health nerd in me, but there's a tendency to feel like because there are these racial disparities, that race is what's causing the disparities as opposed to racism. And really, the root of the problem is racism. There are all these different structural and institutional factors that result in the reasons why Black women or women of color have some of the poorer health outcomes across different health indicators. So that's one that I always like to call out, that it's not because we're Black, it's not because Black people or Black women are doing something wrong or that we're inherently unhealthy, but there are all these systematic and also structural factors that result in us having worse health outcomes.
Amazing. And we've seen it from celebrities. We've seen Serena Williams. We've seen Beyonce. We've seen all these celebrities who that the world is paying attention in. So you assume that as they're going in to see a doctor or physician, that they're going to be treated a certain way, and yet they're still being treated like the majority of Black women out there. And so it doesn't matter. It doesn't matter your socioeconomic status. It doesn't matter your celebrity. It's clearly something that is happening within the healthcare system towards people of color, Black women in particular, that is happening out there. And we've seen it. Like the statistics don't lie, right?
Yep.
The numbers never lie. I'm a big math person. So whenever the numbers are there, I'm like, the numbers don't lie. And so how is Health in Her Hue as a platform, how is that able to address through the different programs that you guys have? What's going on out there?
Yeah, so our platform offers what we like to call the three C's at Health and Hue, which are connections, content, and community. And I'll touch on another myth that the community aspect of Health and Hue addresses. But in terms of connections, Health and Hue connects women of color to culturally sensitive healthcare providers. So providers that sometimes looks like providers who look like us. So we really try to get as many doctors of color, therapists of color, doulas, midwives of color on the Health and Hue platform. But I always make the caveat that, just because a doctor is Black doesn't mean that they're necessarily the best doctor for you, right? But what you want to prioritize is finding a doctor who will provide culturally responsive and culturally sensitive care, taking into account your lived experiences and your full context as they're providing care to you. So we have a provider directory of over 1,300 healthcare providers. Like I said, not just doctors, but registered dietitians, doulas, midwives, lactation consultants, to make it easier for women to find trusted and safe healthcare providers. And then we have a content library that includes articles, video content featuring healthcare providers of color, sharing information and giving education on different health conditions that disproportionately impact women of color. And then the third C, community, we have community forums where women can connect with other women of color who may have the same diagnosis. Let's say maybe you were just diagnosed with fibroids, or you might be going through a fertility treatment. You may want to talk to another Black woman who also was diagnosed with fibroids or going through fertility treatment. And so we have community forums where women can connect with one another. And we also have our programs called care squads, which are peer physician designed peer support groups, again, to give women of color a space to have community and also culturally tailored health education. And I'll double click on that community piece because I think a lot of times people feel that care is better done in isolation or it's just you and your doctor. But at Health Interview, we always say like care is done better in community, which is why I love Harlem Cycle. Like when you have a community of other people, with the shared goal, with shared motivations, it keeps you accountable when it comes to managing your health and wellness. And so that is a core part of our thesis as a company.
Oh my God. Well, listen, that's why we have so much in common, Ashley. And that's why you're one of my favorite clients. No, that is definitely something we've seen not only as a fitness space, but just in general. Like wellness has to be done as a community. There is just no need for competition, but as a collective, that's how we embrace the community and can continue to uplift the communities by doing it together.
Exactly.
Oh, I love that. Well, we won't hold you, so we like for, people to always know how they can find you. So let us know, how can everyone find you after this?
Yeah, they can find me on Instagram at Ashlee J Wisdom, and that's Ashley with two E's. And I would also encourage folks to follow Health in Her Hue. Like I'm the founder, yes, but I would say the work is really on the Health in Her Hue platform. So follow Health in Her Hue on Instagram, Twitter, LinkedIn, Facebook at Health in Her Hue. And then you can also go to the Health in Her Hue website at healthinherhue.com.
Amazing, guys. So you heard it. Make sure to follow Ashley at Health in Her Hue across all the different platforms. Ashley, it has been such a pleasure chatting with you, getting to know more about all of your amazing work. Thank you so much for joining me today.
Thank you so much for having me, Tamika. This has been great.
Awesome. Thanks so much for listening to Wellness Redefined, a production of Rustolian Media. If you want to learn more about our guests, check out our links in the show notes. We'd love to know your thoughts on wellness. Connect with us on Instagram. Our handle is wellnessredefined_. Or visit our website at harlem-cycle.com. Thanks again for listening. If you like what you hear, please share with a friend. We'll be back next time with more on Wellness Redefined. Until then, I'm Tamika Rochester. Take care.